Some complain of pain, a burning or biting sensation in the abdomen or chest area, a feeling of fullness or belching. Peptic ulcer could be gastric in nature, affecting the stomach, or it could be duodenal, which involves the small intestine.
We've talked about H. pylori infection, which carries the highest risk. Okay. There are other habits or lifestyle that some people may engage in that will make them prone to having also peptic ulcer disease. Smoking is one, alcohol is another one, and then some people use some medications, analgesics, we will call them anti-inflammatory drugs, that may also make them prone.
Many take for granted that they have an ulcer when there is upper abdominal pain, but it's important to get a definitive diagnosis to rule out other conditions.
There's so many key things that can cause upper abdominal pain. And we've seen people with stomach cancer gone undiagnosed because every time the person just assumes that, oh, it's just ulcer.
Treatment may appear simple, but must be adhered to for satisfactory and lasting results.
It requires a combination of certain antibiotics and something to help to reduce the acid. If it's from use of non-steroidal anti-inflammatory drugs, what we do is to help to heal the lesion. And to heal the lesion, the first step is we have to stop the drug that is the offending agent.
If one has duodenal ulcer, usually the treatment lasts for about 6 weeks. The first week is what we call intensive phase of treatment, where we use a combination of 3 drugs. Gastric ulcer lasts longer. We treat gastric ulcer for about 8 weeks.
If an ulcer is left untreated, complications could set in. Fortunately, though, owing to advances in modern medicine, the situation might still be saved through surgical intervention.
As I talked about eroding the lining of the stomach, it can continue on and on until the entire line of the stomach is perforated. When there is perforation, it is not just going for surgery, it is emergency surgery.
Because then they can have infection of the abdominal cavity, it can be very severe. Then over time, the ulcer is close to that outlet where the opening, where the content of the stomach empty into the small intestine, the duodenum. That junction. If it happens around there, with scarring over time, that opening can get distorted or narrowed. And when that happens, we have what we call gastric outlet obstruction. So that obstruction has to be relieved surgically.
As the popular saying goes, prevention is better than cure, and experts say this can be done in most circumstances by maintaining high hygiene standards, making sure food is well cooked and carefully handled, and avoiding consumption of alcohol and cigarettes. It would also be helpful to consult a doctor for the proper diagnosis and drug use. Mary Alale Yusuf, Channels Television News.